Now, the World Health Organization has recommended using the vaccine developed by the University of Oxford and AstraZeneca, even in countries tackling new variants of coronavirus. The WHO also says the vaccine can be used in people aged over 65, which some countries have advised against. The Oxford vaccine is seen as the vaccine for the world as it is cheap, can be mass-produced and is stored in a standard fridge. However, it has attracted controversy about its effectiveness against new variants, whether it should be used in the elderly and how far apart the doses should be given due to a lack of data. Joining me for this discussion via Skype is Dr. Azizat Yishao, Senior Health Advisor, Lagos Health Summit. Thank you so much for joining us on TVC Breakfast.
Thank you so much for having me.
Now, let's begin with this report saying that the WHO has given a nod for all countries to adopt the Oxford vaccine and AstraZeneca, talking about the fact that it is cheap and can be mass-produced and can be stored in a standard fridge. But given the concerns this has generated in terms of the fact that there are new variants and there is no data with regards to its addressing this new variant, do you have any concerns with this report coming from WHO?
Thank you very much. I think for me, basically, there is no, I don't have much of a concern because there's no any other option. Currently, even though that we have difference of opinion as to how it's effective compared to other viruses, there still existing data as how far it can also go with other variants. At least with the complete dose, as at 2 doses were 1 month apart, there's a 60% efficiency of preventing or reducing the disease, the virus disease. So in case of, in terms of worry, you understand, we still have something on ground that can at least bring about 60% prevention or the 60% reduction in the rate of disease or infectivity. So when we are worried, I think that most of the concern should be whether or not the vaccine will be causing more harm to those who take it or not. So if it is not causing more harm and we're just in doubt about how effective it is, then I don't think that we should bring that conversation as a huge problem. So we should be more concerned whether this vaccine is going to cause more harm to people that take it, whether the elderly or those with underlying condition, and then work with necessary, work with the WHO, work with necessary stakeholders to also provide more information that can help to collect data and then improve on the vaccine. So that is how, that is what I am most particular about when regarding this information.
Now, data is very key, like you have rightly pointed, but with the divergent views and reaction coming from different countries with regards to the AstraZeneca, and you would recall that Nigeria is expecting some of it perhaps by the end of this month. What do you see with regards to attitude towards this vaccine in terms of vaccine hesitancy and vaccine refusal? Do you have concerns in that aspect, especially when people get to see all of this information and we also not having data? Do you see that happening as we prepare to receive the vaccines?
Yes, very well. I'm very much concerned because there are a lot of factors that affect people's attitude towards getting vaccine. I think that as millennials, as with the information and the benefits of science, I think that countries around the world do not need to put up this kind of reluctance towards vaccination as a whole. Instead, we ought to come together to provide the necessary data that can help us, fight COVID-19 and every other disease that we come account to. So this is not the time to doubt the value of vaccination, because even as African countries, we've seen the benefits of vaccination in terms of curing and eradicating diseases for third world countries. So what is most important, like I would reemphasize, is that we need to be at the table. We need to start conversations. We need to bring up structures. We need to bring up ideas that would facilitate a better vaccination. Yes, we all just dump the responsibility to giant pharmacies in the world, leading countries in the world, and we just want to step back further and then criticize what we are not actually contributing to one way or the other. So while people it's natural for people or for average Nigerians or average citizens around the world to be skeptical about vaccination because they do not have the information. They are not at the decision-making table. They do not have direct access to what is going on. But when we talk about government, when we talk about people in position, when we talk about stakeholders, they are not supposed to be in the position to start criticizing in a way to eliminate or to just push away what this particular vaccine is. Like I said, I will restate again that before a vaccine is released to the public, it goes through several stages to ascertain whether or not it is harmless, you understand me, to the population. They test it in different group of people, young people, old people, pregnant people, people with underlying, just to make sure that first of all it is safe, and then we'll talk about the efficacy of the disease. So when we are reluctant about vaccination, the question I want to ask is that are we saying that vaccination or vaccines do not have a place in terms of prevention of disease, in terms of medicine, in advancement of medicine? Of course, it has a fantastic place. So the conversation or the reluctancy or the pessimism about this new vaccine, the propagandas that are coming, even having some stakeholders continue with such attitude is not something that we need as a country that is not even at the forefront or at the big table of decision making or providing vaccine. Yes, we are expecting some doses to come, and I think that what Nigeria can do is, or other African countries or other countries that are pessimistic, one is to have a table. If they cannot fully participate in the process, then they must be able to observe the process. We have this vaccine that is cheap and readily available that fits some of our how will I call it? Some of the facilities that we can provide. You can store it in the fridge. We don't need extreme temperatures. So what we need to do is ascertain that the product that we are getting are genuine products. And when we have our specialists, we do have specialists, we do have epidemiologists, we do have biologists, we have scientists, we have pharmacists. So we have these people that can actually ascertain that the batches that we are getting are actually what genuine vaccines. And the government can put in effort to ascertain that what they are bringing to their citizens, what they are bringing to their countries are actually genuine products.
All right, from what you have said now, what we expect leading up to we receiving the vaccine is that government should bring stakeholders together to start having conversation that perhaps will change the perception of people towards receiving the vaccine or getting vaccinated when the vaccine arrives at the end of the day, which is also one key issue that government has been harping on in terms of people's perception of even the non-pharmaceutical protocols put in place for COVID-19, talking about hand washing, talking about social distancing or physical distancing as it is called. And we still see the challenge with regards to people's reaction to that and ensuring that they adhere. So what more should government be doing at this time? Taking a leaf from what we have seen with regards to people's perception of the non-pharmaceutical protocols, how should government perhaps position its message now such that it will achieve that effect and that result it wants?
Thank you very much. I think that in terms of communication, we still have a barrier about what COVID-19 is, and despite the fact that there are various platforms that are still trying to communicate this message as regards preventive methods, and as well as the vaccine. I think that one of the things that the government must do at every platform, Lagos State is actually trying its best. I spoke earlier on one of the programs that we need to communicate in local languages. We need to sit at the round table with different groups, with different communities, and have a conversations to them, because despite the fact that COVID-19 is a disease that is ravaging here and we have increased number of cases in Nigeria, you understand, we have this apathy that, we have this attitude that since it's not affecting me, then it will not affect me, and then there's a prayer canopy on it, and this is an integral part of our thought process. And so when government wants to bring out the information, government wants us to understand, because they are at the level whereby they have direct information. communicating in local languages, partnership, discussion, with consultation with stakeholders at grassroots level is also very important. So, despite the fact that there's a lot of going around about information about preventive measures and vaccine, some of these things come in language. And I even challenge TBC, some of your programs or advert that you have on COVID-19. Can we have it in other languages? Can we have it in some of the languages that are peculiar, or even as many languages as possible? Government needs to the indirect effect of COVID-19 is that most people is usually the economic implication, which people can directly see. So people are reluctant to, maybe sit up to the consequences of bringing the social distancing or some of the measures put in place. You understand? So government needs to sit down and have discussion with stakeholders on how best, you understand me, their community can adhere to COVID-19 COVID-19 preventive measures. And at the same time, the government needs to be direct about its response to people who do not, or group of people or individuals that do not adhere to this kind of instructions. Because at the end of the day, we don't want people coming to the hospitals. We don't want our hospitals are already filled up, our doctors are already fatigued, and there's a lot of issues or cases coming up, and it's overwhelming the health system that is still fragile. So we want people to stay at home. We want people to social distancing. So at the end of the day, we need to put things in place. At the beginning of COVID-19, there was a lot of energy towards enforcing some of these rules in public places, and I think that is one thing that what the government can also do. And also the government in part of these activities can also start investing or supporting ideas, technological ideas, system information that will ensure that people are able to gain their livelihood without so much breaking the rules of COVID-19. People, we now have in Lagos, we have telemed, whereby people can and other platform whereby people can actually reach their doctors without having to come directly to the hospital. We have people having to take tests. So in other parts of the countries, I think that the governors or the stakeholders and government should also should also imbibe and take up some of these measures. And concerning the cases that we have in Lagos State, I think this is expected. We know the population density for Lagos State, and we know that this is something that we are aware of, and this is something that we're expecting. So what the focus should be, or what the concern should be, is the rate at which people are able to recover, right. Is the rate at which we're able to reduce the spread of the disease at the end of the day.
All right. Now, there is this issue that a lot of persons have been commenting on, which has to do with Homegrown Solutions, because what we see now is vaccine nationalism across first world countries. A majority of them want to be attended to first. They want to get the vaccines for their citizens first before it gets to other countries. And the concerns for a lot of persons is, why is Nigeria not looking inward, or why are African countries not even coming together to see what solution they can have for Africa moving forward?
I think that is the right questions on everybody. And I think that we have this attitude, you understand me, and because of this, it avails us the opportunity to be pessimistic or disregard God. And I think that it's expected in terms of in what is going on, you understand. You cannot have a country that has dedicated, that has invested in their health sector, that has encouraged their health sector, that are at the forefront of advancement of medicine, that are at the forefront of decision making in terms of medicine. Even before COVID-19 was a pandemic, we have pharmaceutical institutions that were already working on the existing SARS and other respiratory, severe respiratory viruses, and how to provide vaccines and medication for it. So Africans and African countries, the question we put to our leaders is that, what do you think of yourself? Why are we not, a step ahead? Why do we just live at the moment? You understand? So there's a question that we have to ask ourselves: I don't have the solution. The problem is right here and is right in front of us, and we need to start asking ourselves those questions. If this group of people can respond immediately to or immediately and provide solution for the world, why isn't Africa? Why are we not having that conversation that is necessary? Several times Nigeria has been disqualified, you understand? So other countries have been disqualified from even being able to get the vaccine. Why should that come up? South Africa is there one way or the other. They are contributing to the advancements. They are providing data. They are collecting samples. They have pharmaceutical or research institutes in their country that are contributing one way or the other to the bigger picture. So what are other African countries doing? What is Nigeria doing to
All right.
contribute to a larger table? So if we are not doing that, if African countries do not take it upon themselves to be a step ahead, then we'll continue to have this conversation, and it becomes a problem.
All
In
right.
Nigeria, yes, sorry, give me, okay.
We,
All
we,
right,
we
thank you
have
very
to
much.
leave the conversation here now, but WHO says Nigeria was not disqualified, that 100,000 vaccines is just like a drop of water in the ocean, and because other countries had high cases of mortality, and so it had to, give that 100,000 vaccines to them. But that was what they came to clear the air. That was the statement they made. But we must thank you, Dr. Aziza Shao, Senior Health Advisor, Lagos State Health Summit. Thank you for your time on the program.
Thank you very much for having me.